Ideally, I think it would be really awesome to see gender-affirming care be something that just family doctors have some familiarity with and are willing to help with, and that is widespread and normal.
I think taking the onus of navigating care off the patient is really important, and putting some more knowledge in the provider's hands is really important.
My name is Jimmy Dancer, and I'm a trans man living in Kimberley in the Kootenays.
I'm Jessica Childs. I'm a family doctor in Golden. I've been here for almost 12 years and have been part of various projects through the divisions of family practice and shared care. When
I first started transitioning, before I started taking testosterone, there was a period of time where I experienced quite a lot of gender dysphoria and was uncomfortable in my body.
Well, a few things that patients have told me is that the trans community isn't as visible. So while there are gender diverse folks in all of our communities, they feel a little bit alone. And because the population isn't huge and because we are rural, the providers in various areas are a little uncomfortable with the care. We did this project based on the feedback from patients. So coming into the office and hearing people's stories and hearing their challenges and really just identifying a gap. So we have, in a sense, two different roadmaps, and they're based on a project done quite a few years ago in Abbotsford, so we're not reinventing the wheel. One roadmap is a provider roadmap, and that's going to be held with TransCare and TransConnect, which basically shows providers in the area that provide different services and different types of gender-affirming care so that patients can be directed to somebody in their area. The other part of the roadmap is meant for patients, and it's meant for people to have and to access and to kind of refer to over time, as also to give providers something to be able to share with patients. So if a patient comes into an office and they ask a question, then a provider can have some information for them. We know that people across the Kootenays are not going to remember every single service, but we do want primary care providers to be able to provide something to patients when they ask. And so it's meant to be a tool that can be referred to and can be accessed very easily.
I know that a lot of people have fears around the effects of hormone replacement therapy and other gender-affirming healthcare, but my experience with it has been that it eliminated almost all of my dysphoria. It allowed me to be authentically who I am, and it's led me to where I am now, which is totally happy and confident with my body and comfortably, proudly trans.
For me personally, I get to hear a lot of complaints and struggles and people not doing well throughout the day. And it's such a treat and such a privilege to be able to identify a gap and actually do something meaningful to hopefully improve people's lives. It sounds really corny and really cheesy, but it is why we do the work. And I also really love working with shared care because I can sort of provide the problems and the feedback that I'm hearing from patients, and I can really get the support from people like Lisa and Louise to do the work and come up with something that can make a difference.
And I also am really happy to see more information being made accessible to allies and like healthcare professionals, because I think there are a lot of people out there who are open to being supportive, but don't necessarily have the information.
The provider roadmap is going to be really helpful for people to know who's in the area and to know what kind of support they can get. Primary care providers have a really difficult job of having to know resources for everything or whatever or whoever walks into the door. So this will hopefully make that a little bit easier, and then people can provide accurate information and really know what resources we do have in our community.